your source for ultimate health, healing, chiropractic, and medical-related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and I'll be your host today.
And I'm your co-host, Dr. Ruvayn Rubinstein out of Troy, Michigan.
And we're back with our two special guests. We have Michelle Haney, physical therapist, and Melissa McGinnis, physical therapist. And they're both with EURO-PEDS out of Pontiac, Michigan, but see patients internationally. So glad to have you guys back.
Thank you for having us.
So last time we heard, we talked briefly about the type of physical therapy you do, the intensive physical therapy, and how it's different from most other places, well, all other places in the world really, and the certain cage that you use, the certain suit that you use to really work with these kids. So let's kind of talk a little bit about that and kind of explain that to our audience and to other physicians that may be listening as well, so they can work with you a little better.
Okay, very good. So we have what's called a universal exercise unit, and we do refer to it as the cage because it looks like a cage. But it has...
like a batting cage almost.
Yeah. So it has, there's a couple different ways we use it, and we'll show you some video in a little bit that you can see. But there is a belt that the children wear, and we attach bungee cords to this cage-like structure, and it helps support the children so that they're able to maybe stand up more on their own. It gives them an increased sense of self-esteem because it might be the first time they've ever stood without people helping them. And it also frees up the therapist's hands so that we can do some facilitation techniques or help align the body while they're in the cage. So while they're in it, we do lots of different exercises. We do strengthening exercises. We can work on balance and coordination in the cage. Also some functional things like standing up from the floor, things that we take for granted that these kids need to practice, and if they have that belt on them, it helps them in order to do those movements.
It takes a whole lot of weight bearing off, essentially, right?
It can,
essentially
yeah.
No gravity with it, right?
Yeah, we can definitely help. We can either challenge them by adding tension to the bands, or we can make it easier for them by giving them more assistance.
Yeah. And do you guys use the suit on almost all patients or some patients, or there's a lot of patients you can't necessarily put in there because of certain contraindications? Yeah,
so suit therapy, I'd say about half the children that come to our center use suit therapy. There is an evaluation separate for suit therapy. We look closely at their hips. A lot of the kids we work with have spasticity and hip subluxation, which you are well aware, but for the audience, just when the hip starts to come out of the socket. So we'll take a close look at that because the forces that the suit puts throughout the body could cause further harm and subluxation to that hip. So we want to take a close look and make sure that we think it's a safe option. Same thing with scoliosis. If it's a more severe scoliosis, those forces could,
More of your traumatic brain injury type of patients, right? Than not so many, well, scoliosis of course, but if someone has traumatic brain injury and they have maybe a few herniated discs or spondylolisthesis, would those be some contraindications?
Absolutely, yeah. Any fractures or
trauma cases may not be as likely to go in the suit compared to congenital. Is that a safe assumption?
Yeah, some of the other things we look at it would be seizure activity if it's not controlled. It makes the body work harder, so if their seizures are brought on by fatigue, we might choose not to do the suit because we certainly don't want to bring on increased seizure activity. We also, with the scoliosis, it depends on if it's a functional curve, and it's minimal, then we will put some tension bands on the suit.
That's great. That can
on
help.
one side.
Absolutely.
Yes.
Yeah.
But if it's
that's what we see a lot of people with that we see a lot more changes than necessarily if it's congenital, structural.
Yeah.
I think we should show the audience a little bit of what we're talking about here. So we're dealing with cerebral palsy patients. That's what most of these kids that you're dealing with are coming in for this cage therapy. And she's talking about a scoliosis. So because of the cerebral palsy, these kids have a lot of spasm in their musculature, which cause them, when they start to grow, instead of growing with a normal spine that should be nice and straight, their spine, because those spasms, will start growing abnormally. And this is what a scoliosis is. The structures are being pulled by that musculature. So when she puts them into the harness and onto the cage, it's going to help relieve some of the tension there. And the reason that it can't be too bad, if the scoliosis is too bad, it's hard and can put extra stress on there, and then you could have extra trauma to that scoliosis. So chiropractors, we deal with patients with scoliosis every single day. Most of these people don't even realize they have scoliosis. They were in middle school and someone told them to bend over and they said, "You have scoliosis."
Yep.
Next.
there are
Right.
millions and millions of people walking around with scoliosis that have no idea.
Yeah.
And what we usually see with scoliosis too is we see a compensatory curve, where we see it curves one way, and then the body creates a compensation going back the other way. It's very rare that we'll just see someone, totally curved off the side. We
Yeah.
usually always see that secondary curvature as well. And so with a lot of these children, again, because their muscles are in such spasm, it causes them to grow essentially crooked. If you think of you plant a seed or a sapling and the tree starts to little bit crooked at the beginning, by the time it's a big oak tree, it's much bigger. So would you say the earlier you can catch some of this stuff, the better as well?
Of course.
And that's what we see even, not just cerebral palsy patients, but anyone we see with scoliosis. Even if I see, mothers with scoliosis, I encourage them to bring their children in for an evaluation, because if we can catch it before puberty, before the bones start to solidify and harden more, there's a lot less, there's more cartilage matrix when there are children. It's easier for us to see corrections structurally in an x-ray.
And the biggest thing that what Dr. Rodnick said is make sure you get them at young, because what happens is if they have a slight curvature and then they have the growth spurt thinks
By the
that's
time they're the
straight.
big oak tree,
Yeah.
that sapling isn't
Yeah.
just a little.
So you want to
crooked.
make sure you get to it before the growth spurt occurs. And that's why they do most of these scoliosis checks in middle school before the growth spurt. Problem is the treatment for scoliosis is really a non-existent. A lot of my patients, they come in, I have scoliosis. Who told you? Someone in middle school. What did they tell you to do? Nothing.
Or even my physician, the physician saw it, they said, we'll just wait to see if it gets worse.
We'll
And if
watch
it gets
it.
worse,
Yeah.
then we'll brace it. And if
Yeah.
it doesn't work, then we'll do surgery. Well, we don't like that answer. We like,
Right.
if there's
We
a
need to
problem, we
work
want to take care of
together
the
and
problem.
help these
Exactly.
We need to get the scoliosis under wraps so they can, because with lesser scoliosis, more people can get better treatment with you guys for your treatment that you're doing in the cage. So let's work together and get your patients
Yeah,
well.
exactly.
Absolutely.
Absolutely.
So if you could point out too, I know we have our model here, and this is the suit, correct? This is
Yes.
exactly what
Yes.
the suit looks like.
Yeah.
So could you explain it on our model a little bit?
Sure. I think it's important to clarify that the universal exercise unit, or the cage that Michelle was talking about, and the suit are different pieces of equipment. So they can be used together or separately, which you'll see in some of the videos later. I think it's a common misconception that people feel like if they can't do the suit, they can't do the cage, and that's not the case. The universal exercise unit can be used with or without. So even children that either are not appropriate candidates or can't tolerate the suit can still do the cage. But if they're in the suit, they can still go in as well.
The suit's a little more intense than the cage?
Absolutely.
Yes, the cage is more of a piece of therapeutic equipment that we use for strengthening and functional activities. The suit is the garment that goes on to further intensify the strengthening and the positioning, as well as help with alignment. So you can see it's in different pieces. We have the vest, the shorts, the knee pads, and then there's some shoes as well. And really the only thing that's different with the shoes is that there's hooks on them so that we can attach our resistive bands to them. The yellow is the resistive bands, and those are kind of stretchy like a rubber band would be. If you can picture pulling on a rubber band, the way it resists and pulls back at you, that's what the bungees do as well. So the first thing we do after we put on the suit, which is fairly snug, as Michelle said earlier, it gives compression to help with body awareness, balance, is that we try and address any alignment issues we see. So the scoliosis, the curvature we were just talking about, if it's minimal, a lot of the time we'll see some in-toeing or some crouching in the legs. Those are all things that we would first try and address with band placement to improve their alignment, to get it as normalized and close to midline as we can before we start doing our functional training. In addition, that resistance is providing a lot of extra strengthening, because every movement they do through space, even if it's something they can do independently, like get up to the edge of the bed before we go for a walk, is now against resistance. So it just further intensifies the treatment that we're doing.
So you have a 2 to 4 week treatment plan usually with these patients. At what point in the treatment plan would you try the suit on?
Well, the suit is typically something that we discuss before they come. So if it's something that they're interested in, then we'll talk to them about, as Michelle was mentioning, the hip and the spine issues that we would make sure are safe for using it. And it's kind of a decision we try and make ahead of time, so that if they're interested in the suit, they're bringing those x-rays with them.
Okay.
And then we would start the suit on day one. Now, it has happened that families come without the intention of doing the suit. Then the therapist says, I really think they'd be a good candidate, maybe for next time. Then we might do a trial. If we can get those x-rays in the first couple of days, we might initiate the suit later. Otherwise, if there may be a child who's not a good candidate for the suit, but we feel like, well, that's really unfortunate because he could really do with the compression and the alignment, We have other things that we'll try, such as the Theratog or Spios, which are less intensive garments that families can purchase and use at home to utilize during the therapy as well. Or if they've done well in the suit, that might be something we recommend for home. So we do have some different options if they do well with the suit.
Very cool. So we spoke about it, so I'm sure everyone wants to see what it looks like. So we have a few video clips that you can talk about while they're showing. So if we can play those.
So the first set here is really focusing on the universal exercise unit. It's the white cage-like structure you see around this little girl. She happens to be in the suit as well. She was doing some step-ups to strengthen her outer hip. This young man is doing one-leg squats, which again would be something he wouldn't be able to do without the support of the belt and the bungees. The therapist would have to be supporting him at his hands or his trunk. This way her hands are free to stabilize that knee, keep him from locking that out or extending too much. She can help with the other leg, keeping it suspended. So for therapists, we really love this piece because it gives us our hands back in an environment or an exercise where we wouldn't usually have them. This young man's working on weight shifting. He had a lot of anxiety about weight shifting through space, so before we would start with exercises, we would always just get him set up and let him feel the bungees and kind of weight shifting through space while he was looking at a book or an activity. Then we would move into kicking a ball or step-ups, which would help with his gait training, with his ability to clear that foot. And again, you see the therapist is able to help cue that hip flexor in the front of the leg is what her hand is doing while she helps the leg follow through. Again, that young man can't stand without the support of the cage. So if we weren't in the cage, we would have to hold him up, and now I can't cue his leg. So it's really a nice piece to have.
That's awesome.
Pull up. Yeah, there you go.
There's our second video.
And again, let's go. Pull.
So this child has this suit on. She's actually on a therapy ball, which is a great piece of equipment just because it really requires you to use a lot of your core muscles. So with the suit on, it just gives even more input. So this child is in the universal exercise unit, as Mel explained just a few minutes ago. So he is doing some of the same activities, but with the suit on. So again, the increased input
so now it's my
is
turn to hand you a
helping
piece.
him.
You have to reach with
So
this
here's
one.
another little guy. He is actually rolling over
Reach
a
right here.
therapy ball,
Good.
and we're trying
Yep,
to
and
get
then you
him
put it
to use both of his hands. He does have hemiplegia, so he likes to use one hand over the other. So he's weight bearing some, putting weight through his arms and hands, and also reaching with the suit on. Knocking
He's having fun. It
towers
looks like he's having
over.
fun too, huh?
He doesn't like doing that.
And you can see when he walks over, one of the X's is behind his shoulders to really help with his posture and that extension that we're trying to get him to do. When he unweights that arm, that X you see behind his shoulders is helping him to accomplish that activity.
Those are some awesome videos. So I saw a lot of people in the videos with the kids. Are those all staff, or do you guys let the family come in back there with the kids, or can you explain who are all the people with all the children?
Well, we're very spoiled as therapists in that in a traditional pediatric setting, typically it's the therapist and the child, and then you as the therapist have to be the PT and the motivator. And it's hard to have a child engaged in, say, an activity with a ball when you're trying to balance them. They kick the ball, and then you have to sit them down and go get the ball. So one of the people that you'll see would be an aide, a physical therapy aide. So they are trained to assist the therapist during treatment, to motivate the child, to keep them engaged. And we find that that really gets the best work out of the child. When they're trying to turn the page of a book or knock over a tower, they're standing much taller than just because I said, you need to stand up taller. So with children, it's kind of a different mindset on how to get the best work out of them, and that means to engage them. As far as whether the families are involved or not, that's really case by case. We don't have a policy as far as you have to be in the room or you're not allowed in the room. But we are very open to a conversation with the family on what's best for the child. More often than not, the children do a little bit better if their parents are not right in the room, because we're challenging them.
Okay.
Right, we're challenging them. It's hard. So a lot of the time, what happens
and
is
dad are
it's
a
hard.
crutch,
You want to be rescued a little
Yeah,
bit.
you got to get out of the comfort zone.
Right. Other times they're motivated to show off for mom and dad. So that's why it's so important that it's case by case. But if we feel like that's a hindrance, we will kind of educate and say, I know you've come all this way, you want to see it. We have other ways to do that. We have windows in our treatment room. Often we'll do education to go home with them in a video format. So it's not that we shun them from the session, but we want to make sure that their child is getting the best treatment possible. So it's really case by case.
Yeah.
And obviously, it looks like work for the kids, but it also looks like fun. To some of the kids, is it like they're going to a playground? I mean, they're really, they enjoy it, right?
Yeah, I mean, that's the goal. Like, we try to make it fun because, there's different approaches. Over in Europe, sometimes we hear that it's more of an assertive approach where, they're making sure the kids do so many repetitions. And sometimes we have to do that with certain personality types. But we've found if we can make a game out of it or make it about something that they're really passionate about, a sport or something, then they're going to be more actively involved. And that connection with their movements to their brain, it just makes the learning even stronger because, they're actively participating in it.
And they have to because, it must be so important for you guys to have such a good understanding of child psychology because if they're in a bad mood or they don't want to do it that day, they're not going to get the most benefit from their 2-week trip as they would if they were so excited and enthusiastic about it.
Yeah.
And what I love about EURO-PEDS and what I've heard so far is you guys are not cookie cutter. So many of these programs that you hear of, it's cookie cutter. The person's going to come in, they're going to do this day 1, this day 2, and it seems like you guys are very well trained to get the best results, but you do it in a more open environment that probably allows the kid to not be worried about who he's with. I mean, it looked from the videos, you guys are having a good time. It's a very friendly atmosphere, and that is a very positive thing, in my opinion, to see that it's not cookie cutter. I don't like that kind of
We
stuff.
often see that with a lot of, multiple handicapped children. There's cookie cutter, and it's just they're going to go in this often and do this exact same thing forever. Until they're 18, and then they're on their own. They can do whatever they want. So it is really cool to see that it's not that. And it's to us as chiropractors, it's really cool to see that you're interested in communicating or working with other different physicians and modalities. They're normal PT, chiropractors. We see sometimes multi-handicapped children where their therapist or their physician may say, "Oh no, don't go to a chiropractor." But it's really cool that to you guys it seems that whatever can help them, why not do it? And I feel the same way too. Anything that can help, why not?
Yeah, and that's a large part of the programming. Obviously, our scope of practice is physical therapy, but we do a whole lot of education of, you should, check out a chiropractor.
Yeah.
Do you have a pediatric neurologist? Do you have a, or maybe even with some of the children that have increased tone, just different spasticity management options out there. So just educating them and sending them back to other healthcare professionals so that they can get what they need.
Co-managing them.
Absolutely.
Co-manage to get the best results, because at the end of the day, we want the patient to get the best results.
Absolutely.
And you send them home with a lot to do, right? Do they get, you said DVDs, they get a workbook, do they get pictures, what do they get to go home with?
Yeah, it's very customized. We try to get to know each family and give them what we think is going to be successful for them. So there's some families that have a lot of support at home. They have some students that volunteer that could help with the home exercise program. The grandparents are next door, whatever. They have lots of support. And then there's other families that unfortunately don't have a lot of support. So we try to gauge, how much is feasible for them. So we do provide these home exercise programs with digital pictures of the children.
Oh, of them doing the actual exercise.
Yes, because everybody's
really cool.
alignment's so different. So we can point out.
Auntie May to see that, or Grandma to know.
Absolutely. And then there's written instruction as well. And so we'll point out some important things. Make sure his leg is straight or not turned inward. We try to explain it. Because a lot of times, people will have an understanding, but then they get home, and if they don't have this booklet, they might forget.
Flustered.
Oh gosh, was his foot pointed in or out? So we try to create a customized program that's going to help each family. So some families, they might just have 2 pages, and it might be incorporated into their daily routine to make it easier for them. And then there's other families that have a lot of support that are going to get more activities because they're able to, fit that in, with the support that they have.
Definitely not cookie cutter.
Yeah.
Everybody
Right.
gets their own custom,
Their picture on the
custom
front page.
page, custom
No stick
exercises.
figures.
Exactly, no stick figures. I mean, these are them, so that even they can go look through. Okay, this is what I was doing, and like Dr. Rodnick said, anybody can help them once they get home because it's right there.
We feel too. I mean, even obviously these are a lot of multi-handicapped children that are going home with the home exercises. But in my office, we see someone coming in with back pain and we see it's a mild bulging disc, we work on them, but we want them to do home exercise as well. There's a lot they can do at home. I like to use the analogy with people that, think of coming to see me like you're going to the dentist, but you also brush your teeth at home. Most people don't think about their body or their spine until it hurts. That's like not doing anything with your teeth until you have a toothache. Well, obviously, people can see their teeth. They don't do that. So doing a lot at home for patients is so important. I think that's really cool that you guys give such a great exercise regimen. And then do you encourage them to bring this to their physician, bring this to their PT so they know what they're doing?
Yes, absolutely. Sometimes I'm asked for multiple copies, whether it's a DVD or a packet like this, both for the school therapist or the private PT, because a lot of the time the therapist hasn't heard of EURO-PEDS. They don't know where they're going, and there's sometimes what is this therapist have that I don't have? Yeah. So, but at the end of the day, like you said, we're all on the same team. We're all working towards the same goals. And so we really encourage that they show whoever's at home, this is what we worked on, this is what we focused on, so that we're all on the same page. We also encourage communication from those team members. I'll get phone calls from therapists once they get home that say, wow, he looks great. What did you do? What did you focus on?
Yeah. From wherever in the country, too.
Exactly.
It's not like you want them to just, you just see me and just do these exercises. You encourage them to go back to their therapist and to continue to work with whoever they're working with.
It makes a huge difference. I've personally seen in my practice with the families that are able to follow up with the home exercise program. That's the difference between the children that come back to us, whether it's 6 months later or a year later, and they're still where we left them. They've been able to maintain or even get a little bit stronger from where we left them with follow-up at home.
So they can go to that next step.
Exactly. So we can take them to then that next functional level compared to the child who either, there was a lot going on at home, they had another baby, they weren't able to get to it, or perhaps there was a surgery or growth spurt, and now we're trying to get them back to where they were. So it really does, make a big difference in their progress.
Yeah.
And do you have some children that now they've come 3, 4, 5 sessions, and each time you a whole nother jump, a whole nother jump?
Absolutely.
Yeah.
That's awesome.
And they get a new book every time?
They do, and as Michelle said, it really depends. She said it might be a couple pages, it might be several. A lot of that has to do with how many times they've come.
Yeah.
If it's the 10th or 12th time I've seen a child, I might be just giving them 1 or 2 new exercises. The idea is that it's a compilation that they add to it, or if there's something that changed, perhaps, like, for example, stretching or positioning. Maybe we were working on side sitting, and a year later that child, maybe has developed some hip issues. I'm now going to educate them on, we're not going to do side sitting anymore. We need to do tailor sitting because it's a better position for the hip. So we go back and we look at what we've given them, make sure it's still appropriate, and then add on.
So obviously, there's only so much you can send a kid home with. Obviously, you're sending home with their exercises. But something like this suit, that's something that you can only do in-house. Am I correct?
Correct, yes. And I kind of touched a little bit on it earlier. If we do feel like they did really well with it, we do have some things that we will recommend. Obviously, with the contraindications that Michelle touched on earlier, with us looking at x-rays, we don't feel like this is a safe option for home. So it's never something that goes home with them. It's always under the supervision of a therapist. But we can recommend them the Theratogs or the Spios. Things that are neoprene garments with Velcro strapping that can give some of the same input, but aren't going to put the force through the joints that the suit does.
And I appreciate that, because a lot of people, they may see something in, like, let's say our office, and we're adjusting people, and they're like, oh, that doesn't look too bad. I could probably do that. And I've had patients come back, oh yeah, I tried to do that to my wife last night. I was like, that's not good. I went to school for 8 years to learn how to do this stuff. You should definitely not try to practice this at home.
Yes.
So it's good to know that, you have to be trained in this stuff. You can't just, okay, here you go, because there is contraindications, and the last thing you want is to send someone home with this, and then they get hurt, and then it comes back to you. So
well, and parents always have the best intentions. We typically have the suit on a child for usually about 2 hours. Occasionally we'll do a third hour, but it's because we're constantly assessing that patient, and we're adjusting the tension on the bands. Sometimes when it comes to spasticity, if they're having a bad day or maybe they caught a cold, their spasticity increases. It totally changes how we put those bands on the suit. So that's kind of, some of the things that we have to look for.
Just, I'll go to the movies and walk around the mall with this thing on.
And there's concern, again, parents have the best intention, but if it's left on longer than that, that's a lot of force through the body. And it just puts a lot of pressure on all of the organs and everything. So it's definitely something we take seriously and make sure that it's safe. But like Mel said, the good thing is there's other
And the other one,
out there.
it's different. it's neoprene. It's a different polyethylene type of material that you use.
Yeah, and there's
does it
Velcro.
still have bands too,
so-
or no?
Nope, it's
Velcro
Velcro
straps?
pieces, so it still helps align some, but not with as much force through the body. So it's a
Yeah.
safer alignment and, you know, much safer option.
Just to let the audience know, I'm sure you've been asked, hey, can we get one of these? Hey, can I build my kid a cage? I'm sure those questions have come about, and obviously you have to be well trained and make sure that they're doing it correctly.
Yeah, and parents can buy the universal exercise unit, the cages.
Oh, really?
We don't provide the training. It is pretty intense training. There's a lot to learn, lots of different ways to use it. But we just always educate. If we see a lot of families that, not a lot of families, we have some families that have purchased it, but maybe don't use it as much as they thought they would. So we really, you know, try to pose some questions to help them to determine if it's going to be something that's worth the money and useful for them. But we do have a couple of families that have one in their basement, and they follow their, you know, we've given them specific instructions for a couple of activities, and they do well with it.
But speaking about caring about the patient results, because I know a lot of people, they would say, okay, nope, can't. But if you think, obviously with that we spoke about, you don't think it's a good idea, but you are able to buy the cage and hear their exercises, and you're giving the parents the ability to continue working with their child even from home. Not, hey, you have to come back here in 6 months.
Right.
Yeah.
Yeah, for sure.
So as we're just about out of time, how can people learn more about the foundation? How can people get involved, make donations? How can people, you know, help the foundation?
Yeah, so the website would be the best place to start. The
What
website
is the website?
is EURO-PEDS and there's also a link to it on EuroPEDS.org, the clinic website. And then to call the clinic, I mean, we'd be happy to send out brochures that
What's
we
the phone
have.
number?
The phone number to the clinic is, actually I'll give it to the foundation. It's 844-EURO-PEDS, which is EURO-PEDS.
Awesome.
Awesome. Well, thank you guys so much for joining us. It's been very informative, very educational. And they're with EURO-PEDS out of Pontiac, Michigan. I'm Dr. Adam Rodnick, chiropractor out of Commerce Township, Michigan.
And I'm Dr. Ruvayn Rubinstein, a chiropractor out of Troy, Michigan.
We'll see you next time on Ask the Chiropractor. Stay healthy.